This video is going to cover an ED discharge, both how to do the charting and how to view a discharge packet and print one. So the first step you would notice is you would see that your patient is MD done. One of the most important things to remember is that we must make sure that our patient is not a pre-ER, meaning they have not been registered. So what you would ideally want to see is Reg ER, which you can tell on this patient is registered. So you always want to make sure before they leave that they have been registered, because otherwise we don't get the important information we need for billing and to just update the patient's demographics. For today's purpose, we're going to pretend that Tess Diana is in a Reg ER status, and I would know she's ready to go as well because I would see MD done, just like we see in the current system. What I would do is I would open her chart. Remember, we could do this two ways, either clicking in the folder box, or I can click open chart on the right hand side column. We would open our chart and we would go down to where it says discharge plan. We would click that tab and this will open up our discharge screen that would have been filled out by the doctor. So I can tell that she is home self-care. She was seen by the physician ED temp, which would be one of our providers' name in there. I could see that a prescription was sent for her, Zofran 4 milligrams, and I could see a referral was made back to her primary care doctor and that she has a work release note. What I would do now is I would document my vital signs in my assessment if I didn't have one done. The nice part here is that if there was one done, it would say last done and the time. What I mean by this, I will show an example. I check my ED vitals and hit document. And for the demonstration purpose, I'm only going to enter a temperature, but you would want to make sure to always enter everything that's pertinent, including pain, even if it's 0. I would hit save and exit. And now, let's say my tech had just done my vitals or someone else had gone in the room. When I came to my discharge screen, I would see my vitals were last done at 15:48. So the only thing I would have to do was my pain and discharge assessment. If you are not a nurse, you wouldn't be doing a discharge assessment. So if you just wanted to print the packet because the patient lost it or came back, you would go to the same screen and you would just hit print packet at the bottom below, and that would send it to whatever printer your computer is associated with. The other nice option is if this patient is an ER hold, we now no longer have to go to any other special system. We would just go to our order tab, which is right here, and we would make sure we have a discharge order, because remember, inpatients must have a discharge order. If I had that order, I would come back here, I would print a packet, and then I would also select print by type, and I would pick the patient health summary and hit print. The reason you'd want to print this for an inpatient is this is the form that comes out with all of their labs, their CAT scan results, all their information from their visit that's pertinent when they go follow up with their primary doctor that is given to inpatient admissions. Very nice. It's all kept in the same system. You don't have to go anywhere. If this was just a regular ED patient, we would go and we would click what we needed to chart. So for example, my pain needs to be charted and my ED discharge assessment, and I would hit the little blue doc box. I would hit it. This would let me open up both assessments. So in this case, I'm going to say my patient has no pain reported, and now I can do my ED discharge assessment. As you will notice here on the ED discharge assessment, only 2 questions have stars. The reason for this is that you're going to do the same discharge assessment no matter whether the patient went home, whether they were admitted, whether they went to the OR, whether they left without being seen, which is this LWBS, or whether they eloped after eval. So this would apply for patients who get seen by the triage provider and then walk out. Or if they had expired, you have those options too. We kept it simple, so it's always done the same way. So in this case, if my patient eloped and I didn't see, I could just put other and type eloped here so that I don't pick a discharge condition that I don't know. Or in most cases, you would hope it would be stable or fair or good, and then home. And then you fill out what applies to the patient. You're going to see a lot of information on falls. This is a big thing that we should be providing education on, and we all do, we just don't document. This covers also for our inpatient admissions a lot of things that we should be covering with them. Here on the response to teaching, you're going to see an option for teach back. This is the preferred method, and it's actually something being tracked as a core measure in a different sense than a normal core measure, but they're tracking this because this is the preferred way to teach, and this is what actually is being pushed for the hospitals to do. And you guys all do this. You say something to the patient, you have them repeat it back, or you teach them something and have them explain it back. We all do it. It's just a different way of wording it. Another thing I want to point out here is if you guys see this question here, discharge instructions given to patient by provider. What this is going to be used for is, it's not did the patient get discharged by a provider. Of course they did. They got discharged because a doctor put in the order or said MD done. But what this is referring to are those patients that come in and you physically never see as the nurse because the provider discharged them. Nothing wrong with that, but what we don't want you guys to do is now go back to that work list and falsely document assessments to get them off your tracker. If you didn't see the patient, you're not going to document assessments. The good thing is these patients would have been triaged, so they would have a triage note, a set of vitals, and then the doctor's assessment and orders. So you don't have to worry about putting in assessments that we didn't do because we don't want to falsify our documentation. If the patient had been discharged by the provider, you would still be prompted to enter a condition on discharge and a disposition, and you would know whether they were stable or not. You would hope a doctor would not send them home if they weren't, and you would just check off patient instructions given to patient by provider, yes, and you could say here, patient discharged by Dr. Doolittle, and you would just save and exit. Because we didn't discharge them, we're not going to say what education was done, and this is just a new thing we want to make you guys aware of. You also have for other types of discharges or transfers, you have, was a W-10 complete and sent with the patient, was the EMS transport form done, was any hospital pump sent, and if so, you can even put the ID of the pump so we make sure we get it back. The nice part here is you have discharge comments, but if you wanted to write a comment on the patient or a note, on any assessment you have the option here below, add note. If you click this, it brings you to the note section, but still keeps you on the discharge screen. Adding a note under any assessment by using this feature, it ties the note to this assessment you're currently on, but it also places that note in the note section. So it's double documenting for you without you having to repeat your note again, which is a great feature. So once I'm done with all of this, I would hit save and exit. I am now done with my discharge assessment. I would have already had the patient's packet printed and had them sign. And now the most important thing is if this was an admission, the admission time would have defaulted here. If the patient had expired, we'd see another tab that said expired date and time. And if we're discharging them home, you're just going to click that field and you're going to enter the date and time. If it's now, you can hit N for enter. The most important thing to remember here is that this is the time that our core measure is tracked by. So it is important that if you have an ambulance transfer and they got put on the stretcher 2 minutes ago, because it's going to take us a few minutes to go through this assessment, we want to back time to the time the patient truly left the department. So I can see here I started my documentation at 15:49. So at the very minimum, the patient left a minute or so early. You want to make sure this time is accurate because this is what we get measured on. So what I mean is most of our cath lab transfers make it out in time. Sometimes we miss it by a minute or two, and it's not really that we missed the measure, it's that we didn't back time our time. Once we hit save, it's going to say, give you a message. This will pop up in real life if you have a patient that eloped because you might not have a doctor that had signed up, which is fine. There's not a problem with that. We want to hit save, and now that defaults our time and you see save is no longer an option. I could continue to chart on the patient, so please do not keep the patients on the tracker for charting purposes. There is no need. You can keep charting on the patient in real life, and it's not going to change anything, but they're going to fall to a discharge status and fall off the tracker. So I can see here that my status now defaults to discharge, and let's say that I had signed up for the patient. I would have been able to go to lists, and under my list, I would be able to see that patient here, and it would look exactly the same they were on my tracker before. It's just that the patient's in a discharged status. So there is no excuse to keep the patients on trackers. We need to be removing them in real time, and it's especially important for our tracking. Another way you can also see them is once the patients are discharged. So in this case, this patient was admitted and was discharged. They fall onto my discharge tracker. any patient, once we go live, will truly fall onto this tracker because they're going to be registered, etc., and we're going to be live. You see that the discharge tracker looks exactly the same. So if you had to document, you could come back here and document for 72 hours. We shouldn't be documenting that late, but if you had to look up something like a patient got transferred or they needed their discharge packet again, you could open up the chart and view the things exactly the same as we would if they were a patient. You also have the option here of a little calendar, which you can click and search back through old dates for discharged patients. So a little bit cleaner than the method we have now, and just a couple of changes we wanted you guys to be aware of.